Hello again and welcome back. I hope you're ready to dive a bit deeper into HIPAA. I'm Harold, and today we're going to talk about one of the most important components of HIPAA, the Privacy Rule. This rule protects health information, also known as PHI or Protected Health Information. Let's break it down. So what exactly is PHI? Protected health information includes any information about a person's health status, treatment, or payment for healthcare that can be linked to them. Basically, if it's something that can identify someone and it's related to their health, it's PHI. Under HIPAA, PHI includes 18 specific identifiers that, when linked to health information, make it personally identifiable and subject to HIPAA regulations. These identifiers range from names and contact details to medical record numbers and biometric data. Understanding them is essential for maintaining compliance and protecting patient privacy. Take a moment to review the list carefully, as even a single identifier can transform general information into PHI. Now that we've covered what qualifies as PHI, we'll move forward. When it comes to protecting health information under HIPAA, responsibility falls on two key groups. Covered entities like healthcare providers, health plans, and healthcare clearinghouses are the organizations that collect and manage patient data. In clinical research, this might be the hospitals or clinics conducting a study. Business associates support covered entities by handling PHI. If an external vendor processes clinical trial data, they are a business associate and must follow HIPAA regulations. But what happens if that vendor relies on another company for services like cloud storage or IT support? That company becomes a subcontractor under HIPAA, meaning they must also comply with all business associate obligations. To ensure accountability, subcontractors must enter into business associate agreements and follow the same strict security measures as any other business associate. No matter how far down the chain PHI travels, every entity handling it is legally and ethically responsible for its protection. Now, put yourself in the shoes of a participant in a clinical trial, sharing sensitive medical information. You'd want to be assured that your personal details are protected, right? That's our goal, conducting ethical, responsible research where participants are more than just numbers. They're valued individuals. HIPAA ensures that participants' rights are respected, their information is secured, and trust in the research process is maintained. Another crucial aspect of the privacy rule is patient rights. Under HIPAA, participants in clinical research have control over their health information. They have the right to access their records, meaning they can request and review copies of their medical information. For example, a research participant might request their treatment history to better understand their care. They also have the right to request corrections if their information is inaccurate or incomplete. Suppose a participant notices their birth date is incorrect in the study database. They can ask for a correction to ensure accuracy. Additionally, participants have the right to know who has accessed their data. They can request a record of when and why their information was shared. For instance, a participant may ask for a disclosure report to see if their data was shared beyond the study team. Imagine you're in a study. Wouldn't you want to know exactly who has your information and how it's used? That's the protection HIPAA ensures. So, here's what we covered in this session. PHI is any health information that can be linked to an individual. Covered entities and business associates are responsible for protecting PHI, and study subjects have rights under the privacy rule that we must respect. Understanding these key elements helps ensure that we're conducting ethical and compliant research. That's it for now. Next time, we're going to look into how PHI can be used or shared in clinical research, when we need authorization and when we don't. There's a lot to it, but don't worry, we'll break it all down together. See you in the next video.